So first is, this is trapezius. So one thing to remember, trapezius is little bulky in the lower part. When it goes in the upper part, or it is attached in the occiput, it is very thin. I'll be showing you how thin it is. Very thin layer of muscle. So I am removing it. And then very important muscle here is your semispinalis. Semispinalis is very bulky, and it has the two part. One is your medial fascicles, and these are the lateral fascicles. So I'm removing those things, medial fascicles and lateral fascicles. So what we have seen, first was your trapezius, and below trapezius, from the midline to lateral, the next muscle below the trapezius will be very bulky, semispinalis capitis. And if we are going lateral side, this will be your the splenius capitis. Splenius capitis is also a little bit thicker, but it is not as thick as semispinalis. So the semispinalis is much thicker, bulkier muscles than the splenius capitis. So I'm removing the splenius capitis. And another thing you remember, this is your sternocleidomastoid. Sternocleidomastoid is a very big, thick muscles. And another thing to remember, sternocleidomastoid here is almost triangular in the lower part. And here, when it is getting attached here in the mastoid, in the occiput, here it will be like a strap muscles, thin layer of muscles. And below that is your splenius capitis. So I'm removing the splenius capitis, and then the other deeper muscles are exposed. So one important muscle here, this is your the rectus capitis. Rectus capitis posterior minor. So this is between the occiput and the first C1. And just beside that, and this is much bulkier, and that is the name also suggests, that is your rectus capitis posterior major. This is much bulkier than this is a thin strip of muscle, this minor. So you'll be able to see these muscles also, these muscles also. And this muscle is very, very important, particularly when we are thinking of the greater occipital nerve block. So it starts from the spinous process of the C2 and going to get the attachment attached in the C1 there, the obliquely. So this is your the obliquus capitis inferior, and here it is your obliquus capitis superior. So these are the muscles what we will see. And the other important muscle here is your the splenius cervicis. I'm removing that. Then comes your the longissimus. Longissimus will be just under the cover of the splenius capitis. We'll be able to see the longissimus. And when we'll be coming little below, this muscle is again important. This is your, it has the several strips. The superficial most strips goes up to the C1. So you'll be able to see these levator scapulae as well. So these are the muscles we'll be able to see. And in between the layers of the muscles, we'll be able to see the nerves also. So I'll be just showing the nerves as well a little bit again. I'm putting the nerve here. So here at this superficial cervical plexus, one nerve will be going above, along the posterior border of the sternocleidomastoid is your lesser occipital. So you'll be able to find this nerve. Second one is your greater auricular nerve. These are the two nerves which are going above as V, the two part. These two nerves are nicely seen. Then these two nerves, not that nicely seen, but anyhow, I could find it in the volunteer and I'll be able to show. One is going down, but it is going anteriorly over the sternocleidomastoid muscles. This is the transverse cervical nerve, and another, it is getting branched in the lateral media intermediate is the supraclavicular nerve. So these four nerves coming from the superficial cervical plexus will be showing these things. Apart from that, another important nerve is below the semispinalis capitis, above the rectus capitis inferior is your greater occipital nerve, and medial to that of the greater occipital nerve at the same level, we'll be able to see the third occipital nerve. Greater occipital nerve is a thick nerve and easily identified.
I'm starting scanning from the posterior midline. How you can see here is your occiput, and when I'm coming down, you can see this is your trapezius, very thin layer of trapezius. This is your trapezius. So this is your thin layer of trapezius, and then I am coming down. So I'm starting from here, occiput, and then I'm coming down. The semispinalis muscle has started. Okay. So this is your C1. So here what is important is we will not be able to see the spinous process, which is there, which will be coming down at the C2 level. So if I'm coming down, occiput, then comes, this is C1, this is C1, and then the C2 is coming, and C2 will be having the bifid spinous process. So this is your C2. This is your C2. So now if you are looking about the muscles, what we can see here. So at this area, okay, let me freeze it here. So the hot muscles we can see here is your, this is your trapezius, this is your semispinalis, medial part, medial fascicles, this is your semispinalis lateral fascicles, then this is your the rectus capitis, your posterior minor, and this is your rectus capitis posterior major. Rectus capitis posterior major is your little bit lateral to that of the rectus capitis posterior minor. Again, so from here the occiput, then if you are coming little bit deep, will be coming the this one, and then this is C1, and then when coming down, we'll be able to see the bifid spinous process here, the bifid spinous process, and this is your C2. So at this point, if we are going laterally from the C1, C2 junction or C2, if I am going laterally, you can see whole of this is your the semispinalis. Whole of this is your semispinalis, and I am in between the C1 at the level of the C1. So this is your semispinalis. Sorry, this is your whole is semispinalis. This is your rectus capitis posterior minor, and this is your rectus capitis posterior major. And then I was at this level, and now I am coming more down at the level. Okay, before that, at this level, let me go laterally and see what else we can see. So when we are going laterally, these muscles which is appearing, you see, on the top above the semispinalis muscle is your splenius capitis. If I'm going laterally, this is your splenius capitis, and below that, I'm freezing. So here, what you can see here is your, this was your semispinalis capitis, and that above that, this was your the splenius capitis, and this is your longissimus capitis. What I was showing here at this point, this was C2. Just above that, C2, above that, we can see the rectus capitis posterior minor and major, and at this level, if I'm going laterally, this whole bulk is your semispinalis, and if I'm still going laterally, on the lateral side, we can see the splenius capitis, and below the splenius capitis, below the splenius capitis is your, below the splenius capitis, this was your splenius capitis, whole is your splenius capitis, and below that is your longissimus, and this was your semispinalis capitis. You can see part of it, and above that one muscle has started appearing is your sternocleidomastoid. I just told you here the sternocleidomastoid is like a strap muscle at this level. Okay, so now if we are looking at this level, just lateral to the sternocleidomastoid, we'll be able to see the lesser occipital nerve. Let me search lesser occipital nerve at this point. This was your, the top muscle is your the trapezius, thin layer, and below that is your semispinalis capitis. If I'm going laterally, you can see the splenius capitis, below the longissimus, and you can see this lateral side, the muscle, this muscle is your, and you can see the nerve there. Please, okay. So here, so this is your sternocleidomastoid. Again, what are the muscles you can see here? This is your splenius capitis. This is your longissimus, and here you can see is your lesser occipital. So here is the lesser occipital nerve, and normally the lesser occipital nerve, it curves around, it comes on the posterior border of the sternocleidomastoid, and it goes above. So now I'll be just coming little below. Let me increase the depth a little bit. Okay, so I am at the level of the C2 now. So at the level of the C2, if I'm going laterally, so now what muscle you can see at the level of the C2? Because the rectus capitis posterior major muscle you cannot see here, because it is already inserted into the spine of the C2. So here, if you are going laterally, please correct. So what muscle you can see here? So here, this is the lamina. So this is your semispinalis capitis. This is your bifid spinous process, and this muscle is your obliquus capitis inferior. So now we have to find search in between these two facial layers, and it will be very nicely seen. When we are making it oblique, I'll be seeing this obliquus capitis inferior muscle both in long axis as well as in the short axis. Okay, so this is your C2. This is your C2. You can see the lamina very nicely, and I am coming there here on this side. You can see the obliquus capitis inferior. Now what I'll do, you see what I'm doing, look at my probe position. I'm just rotating my probe. It was initially like this. So now I'm rotating the probe like this. That means the lateral end of the probe, that means the aspect marker, I'm rotating towards the C1. See, I'm rotating like this. And in that way, I'll be able to see this obliquus, because if you are remembering, obliquus origin and insertion, so it is oriented like this. And now we can see the obliquus in a long axis. So in this way, I can see the obliquus in a long axis, and I can found the greater occipital nerve in between this semispinalis capitis and your. Okay, so this was C2, and we can see the obliquus above semispinalis, and above that is your trapezius. So what I am doing, I am tilting the probe. I'm tilting the probe, and you can see the greater occipital nerve in between the facial plane. Just in the middle of my screen, just round shaped, which is going up and down when I'm tilting the probe. Can you appreciate that? I'm just making I'm freezing it here. And then again, I'll be showing you. So this was, look at this. And it is accompanied by a vessel. Lesser occipital is not accompanied by a vessel. So again, I'm holding the probe over the C2, and I'm tilting the probe like this. If I'm coming down, basically nerves wraps around the obliquus, the capitis inferior, and that is the reason why if I'm coming down, the nerve and the vessel comes laterally. You just follow these dotted things. You can see when I'm tilting the probe down, it is going laterally. when I'm moving the probe up, it is going medially. And I'm seeing this in the short axis. I'm seeing this in the short axis. And if you are looking about almost towards the midline, then you can see another, another nerve. Just when you're moving, you just follow that nerve as well. That is that dot as well here. That is your third occipital nerve. So again, I'm unfreezing, and again you just look at these two dots and look at my probe position. So I am over the C2, and now I am going laterally, now tilting the probe, and at this position I am just moving up and down, and we can see this. The extension of the neck is important. So I'm coming down. I'm now seeing this obliquus. Now we can see very nicely one dot here, and another dot here, this one. And now if I'm keeping that dot in the center, greater occipital nerve, and I can see the greater occipital nerve in the long axis as well. You see the greater occipital nerve, I'm tilting. Look at my tilt, how I'm tilting the probe. I'm just making it opposite, and you'll be able to see the long line. See now this long line, and I'm just again tilting the probe. You see it is going medially, laterally. So this is your, and if I'm freezing it here, look at my probe position here. Okay, so now what I'm doing, I'm looking that I'm seeing here the two muscles here. Okay, you see the long axis now. Medial side is your greater occipital, the third occipital nerve, that is also very nicely seen. Just right side of my screen, and the greater, this is your third occipital nerve, and this is your the long axis, the greater occipital nerve. And again, so I was here, and here at the short axis, you see how I am holding the probe. Now I am perpendicular to the obliquus capitis inferior. So, and also I can see part of the okay. So here, this is your obliquus capitis inferior in the short axis, and this is part of your the rectus capitis major, rectus capitis posterior major. So both are seen in the short axis because both are little bit oblique. These are, this is more vertical. The obliquus capitis posterior major is more vertical, and obliquus capitis inferior oblique is more oblique. But at this angle, you see, if I'm holding the probe like this, I'm seeing it in a short axis cross section. And when I'm tilting the probe like this, I can see the obliquus capitis inferior, that is your in the long axis. But at this point, I cannot see the obliquus the rectus capitis posterior major. At this, I cannot see the posterior major. But if I am tilting like this, then I can see the obliquus capitis posterior, because this part I have moved towards the C1. So when I'm going towards the C1, then I can see, because as I told you, the rectus capitis posterior major, it is inserted into the C2 spinous process. So when I am holding the probe over the C2 spinous process, I cannot see the rectus capitis posterior major. But when I'm tilting towards C1, I can see it nicely. And at this point, I can see the short axis of the obliquus capitis inferior as well. Okay. So let me clear the drawings and let me unfreeze. Okay, so we have seen the greater occipital, lesser occipital. Now I'll be showing the, so again, just for the, because the greater occipital nerve is one of the very important. So just and third occipital also. So again, so starting from occiput, then I'll be seeing over the C1, and then I'm coming the bifid spinous process. So at this point, I am at the level of the C2. And you see what is my probe. And now what I'm doing at this point, I'm tilting the probe, the lateral side of the probe towards the C1. And at this position, I can see, make a probe, tilt probe little bit here, and you can see the greater occipital nerve on the lateral side, the third occipital nerve on the medial side, and I can see the cross section and the long axis of the whole of the obliquus capitis fibers are very nicely seen. So this is, you can see the whole of the long axis of the obliquus capitis inferior. And if I'm tilting the probe like this, you see the muscles, now we are seeing the cross sections, and now you can see the two muscles cross sections. The medial one is your small one, is your rectus capitis posterior major, and the lateral one is your obliquus capitis inferior. And here you can see the long axis, the black line in between the facial plane is your long black line is your the greater occipital nerve, and on the medial side a smaller, not that long line, that is your third occipital nerve.